So I'm quickly going to discuss about the clinical trials and navigating the role of palbociclib in metastatic hormone receptor positive breast cancer. So we all are aware that breast cancer is the most common cancer seen in the Indian woman as per the Globocon 2020 data. Majority of the patients are hormone receptor positive, and approximately 10% of the patients which we see in our clinical practice are metastatic to begin with. Tamoxifen was the first hormone therapy that was approved for hormone receptor positive breast cancer, and it was way back in 1977. And after that, till 2002, we see lot many hormonal therapy that have been approved. And after a long gap of almost 10 years, we have seen a significant advancement in the management of metastatic hormone receptor positive breast cancer with the advent of CDK4/6 inhibitor, and palbociclib was the first one to enter the routine clinical use. I'm sure we all are aware about the mechanism of action of CDK4/6 inhibitor. These drugs basically they block the cell cycle from G1 to S transition phase, and this transition from G1 to S is tightly regulated with the help of various cyclines as well as CDK4/6. And these CDK4/6 inhibitor, when are used, they block the cell cycle from G1 to S phase. Palbociclib has been approved in metastatic breast cancer patient in first line as well in second and later lines of therapy. Now, quickly, I will summarize the global phase 3 trials that has led to the approval of palbociclib in hormone receptor positive metastatic breast cancer. The Paloma 2 is one of the pivotal trial which evaluated the efficacy of palbociclib in treatment naive hormone receptor positive breast cancer. These are the patients who had not received any treatment in the metastatic setting. Such patients were randomized in 2:1 ratio to palbociclib with letrozole versus letrozole alone. And we can see here that with the use of letrozole, there is doubling of the progression-free survival from 14 months to nearly 28 months. The various factors have been looked at in this subgroup analysis to find out if there is any subgroup which is likely to have more benefit versus less benefit with the use of palbociclib. And it has been seen clearly here that whether the patient has visceral disease or bone only disease, whether they have long treatment free interval versus less treatment free interval, or patients who are elderly versus non-elderly, all subgroup had benefited with the use of palbociclib. So to conclude, palbociclib, when used in first-line setting, along with the aromatase inhibitor letrozole, it has led to the doubling of progression-free survival. This therapy is fairly well tolerated. Most common adverse events seen being is the neutropenia, and the febrile neutropenia was extremely rare. Another important trial in the metastatic setting is the Paloma 3 trial. Herein, the patients who have received one line of either hormonal therapy or one line of chemotherapy in the metastatic setting, that means patients who have been exposed to one line of therapy in metastatic setting were randomized in 2:1 ratio to palbociclib with fulvestrant versus fulvestrant alone. At the updated overall survival analysis with a median follow-up of 74 months, it has been seen that the use of palbociclib with fulvestrant has led to a higher overall survival, which was 35 months compared to 28 months with the fulvestrant alone. Since this trial, there was stratification factor in terms of endocrine sensitivity. It was seen that patient who had an endocrine sensitive disease, they had a statistically significant improvement in the overall survival, and the absolute improvement in overall survival was 10 months with the use of palbociclib. However, the overall survival was not statistically significant in the subgroup of patients who had endocrine resistant disease. Similarly, the PFS also improved with the use of palbociclib, and there is almost 7 months absolute improvement in the progression-free survival with the use of palbociclib. So Paloma 3 concluded that with the use of palbociclib in second-line therapy, there is a meaningful improvement in progression-free survival, as well as there is an improvement in overall survival in subgroup of patients who had endocrine-sensitive disease. We all are aware, and we all have been using palbociclib since more than 5 years now, that this drug is fairly well tolerated. We hardly see any toxicity. Grade 3, grade 4 non-hematological toxicity is extremely rare, and the most common side effects seen being the neutropenia, which can be easily managed, and febrile neutropenia is less than 2%. Because of the neutropenia, we have to reduce the dose of palbociclib, and there was a worry in initial period that whether the dose reduction will have some detrimental effect on the outcome of such patient. And this is the landmark analysis that was done at 3, 6, and 9 months, and it has been shown that there is no detriment on the outcome of patient if the dose of palbociclib was reduced due to toxicity, predominantly neutropenia. And this is the overall analysis from the Paloma 3, which have shown that there is no effect on the efficacy of palbociclib with the dose reduction. With this pivotal trial, there has been many studies which looked at the real world efficacy of palbociclib, and this is what I'm going to discuss in the few of the more slides. This is the Phaeton Trust Network, which looked at the outcome of hormone receptor positive postmenopausal patient, and the data was taken from the electronic health records. You can see here clearly that there has been an improvement in progression-free survival with the use of palbociclib, as well as there is an improvement in overall survival. So these results reflect what is seen in the major pivotal trial in first line and second line setting of metastatic breast cancer. There's also another real world study which looked at the usage of palbociclib with letrozole in metastatic breast cancer patient, and this was also a retrospective analysis that of around close to 660 patients that evaluated the efficacy of palbociclib in metastatic breast cancer patient. And you can see here clearly that in the unadjusted analysis, the response rate were close to 60%, and it has shown the improvement in overall survival, and the median of overall survival has not been reached, whereas in the letrozole alone arm it was 43 months. Similarly, there has been an improvement in progression-free survival with the use of palbociclib in this patient population. So these results also mirrored what was seen in the pivotal trial, which re-emphasizes that palbociclib is definitely an effective drug. This is an important study, IRIS study, which evaluated the outcome of patients who have been treated in 4 different countries. And this main outcome was to look at the efficacy of palbociclib in first-line endocrine therapy. This is the patient population that was enrolled in the IRIS study. And you can see here clearly that in first-line therapy, the response rate were close to 80% across various geographical locations. Similarly, in second line, the overall response rate were markedly similar. So this study also concluded that whatever was seen in the pivotal trial, that same thing has been reproduced in the real world study. Another important study is the Madeline study. This basically looked at the neutropenia and the effect of neutropenia on the quality of life. So patient reported outcome was looked at, and you can see here from the graph that either due to neutropenia or due to usage of palbociclib, there was no effect in the quality of life, and the quality of life of the patients was maintained throughout the study period. This is also an important study that looked at the treatment satisfaction of the patients who took palbociclib. This was an observational web-based survey which included 604 patients, and patients, they themselves reported whether they were satisfied with the treatment or not. And these were the various domains that were assessed in this treatment satisfaction survey. Predominantly, what were the expectations from this study, what were their feeling about the side effects, and whether they were satisfied with this therapy or not. And the results showed here that more than 90% of the patient reported that whatever the side effects they experienced, they were better, either expected or better than they expected. Majority of the patient could return back to their normal life and they can join their work. And more than 95% of the patient felt that this medication has expected their benefits. And there is also quite a bit of data published from India as well regarding the real world efficacy of palbociclib in routine clinical practice. And this was the study which was done at Rajiv Gandhi as well as BLK Hospital from Delhi, which evaluated 188 patients who were treated with palbociclib in either first line or second line setting. And they have also shown that the median PFS was 20 months and the overall response rate was 80%, similar to the ID study. And majority of the patient tolerated this well. This is another study which was done from the South India, and here they have shown that the median PFS in first line has not been reached, whereas the median PFS in second line was 14 months. We also did this similar study and looked at the we also did a retrospective analysis of our patient who were being treated at Tata Memorial Hospital with the CDK4/6 inhibitor. Here, more than 90% of the patients received palbociclib, and total we had 101 patients. In first line, we have also seen that median progression-free survival was 21 months, and majority of the patient tolerated it well. So what can we say about palbociclib in the end? That it is definitely a significant advancement in the management of hormone receptor positive metastatic breast cancer. This drug has manageable side effects. Patients are satisfied with this drug. Their quality of life is maintained, and it has led to improvement in progression-free survival, and it has led to improvement in overall survival in select group of patients. Thank you so much for your patient hearing.